Bismillahirrahmanirrahim and Assalamu alaikum. I am Professor Mahmood and currently I am working as a professor of surgery and the vice president of the College of Physician Surgeons of Pakistan. And also I am the director of the National Residency Program. So in this capacity, I'm going to speak about the evolving role of Cpsp in the surgical training in Pakistan. You know, the surgical education has undergone a tremendous transformation since its advent in the early 20th century, transitioning from an apprenticeship and a journeymanship towards a training model based on knowledge of basic sciences, research, and patient care for the resident. We all know that initially there was a model of apprenticeship where in the Western world, people will be taken as an apprentice at the age of 12 years, and they would have a 5 to 6 years of apprenticeship, and they would, by the age 17 or 18, they would be declared as well-trained doctors. And then they would also have the journeymanship, which is just like a fellowship where, you know, in apprentices, a surgeon could have 4 or 5 apprentices, but in the journeymanship, they would have only 1 or 2 people. So the apprenticeship was like the residency training, and the journeymanship was just like a fellowship training. But this model has almost changed. So at Cpsp, you were faced with 3 basic questions. One, that how can we improve the surgical education? Second, how do we train competent and professional surgeons more efficiently and effectively? And third, how can we reorganize surgical education to train residents able to achieve better surgical outcomes? So the focus was on reorganization of surgical education so that we could have the ultimate goal of better surgical outcomes. Now, the first question, that is, how can we improve the surgical education? Before we actually embark upon that, we must understand that in the today's environment, we have got a different medical learner or a surgical learner. And if you want to really answer that, how can we actually improve the surgical education, we should first actually examine the shifting of the medical environment in which we practice today, and how the medical learner has changed from generation X to generation Y. You know, today medical students and surgical residents were born into the millennial generation. The millennial generation, or the generation Y, includes individuals who were born from 1982 to 2004. So most of our surgical residents at the moment, they belong to generation Y. Now the millennial generation not only differs from generation X in the characteristics, but also in the learning style as well. This generation of medical students learn by assimilation compared with the converging style of general surgery residents and the faculty. Now, to train these learners effectively and efficiently, one must consider not only what is being taught, but also how is it being taught. So we must understand this basic difference. And I will just elaborate upon, you know, how these medical learners are different. You know, there are 2 terms. One is known as a digital native, and the other one is a digital immigrant. Now, let me talk to you what is a digital native. Now, digital natives are those people who are born into the era of digital technology. Now, when they were born, they were well accustomed with the internet, with the computers, and with the gaming devices. So they started learning from the gaming devices. They went into the computers, they went into the internet, and then into a lot of gadgets which are, you know, utilized in the social media. So this term digital native was basically coined by Mark Prensky in 2010. And just as a native language, like our native language is Urdu, we are actually, when we are born and when we learn, we start learning everything in Urdu. So these digital natives, they start learning the digital technology, you know, right after they were born. And similarly, Prensky stated that the arrival and rapid dissemination of digital technology in the last decade of the 20th century has changed the way digital natives think and process new information. It makes it difficult for them to excel in the traditional classrooms using outdated teaching methods commonly used in the medical education today. So these were the digital natives. Now, most of the surgical educators, like people like me or people like the trainers at the moment, are basically known as the digital immigrants, or individuals born before the widespread adoption of digital technology and therefore are forced to adopt the technology to survive in the today's environment. As digital immigrants try to learn new digital technology, they always retain certain old habits. Like, I'm more comfortable reading the manuals instead of trying to read this from the net or directly from the books downloaded from the net. And sometimes in the early era, I would always like to actually download the emails on a piece of paper, read them, and then answer them back. Because, I was learning a new digital language. It was difficult for me, but actually we had to learn this. So essentially the digital immigrants like me are learning a new language every day. A language learned later in the life uses a different part of the brain than one learned as a primary language. Literally, digital natives think differently from digital immigrants. So that is the basic difference. We are the digital immigrants. We were not born into this technological era. We learned this technology and we were actually forced to learn this technology. So we actually try to assimilate knowledge and distribute knowledge in a different way, in a different technology. Whereas these people who are born in this digital era, they actually try to assimilate and try to learn and try to actually, adopt with the new technologies. So there's a way of learning. So if you really want to improve the learning of our surgical residents, we must understand the difference between a digital immigrant, which we are, and a digital native, which they are. So we have to actually modify our training into a pattern where they can actually learn this, technology of surgical training in a much better way. So if we actually, this is just a comparison between Generation X and Generation Y, just to elaborate my point. We were mostly born in the era between 1960s and 1979, and their year of birth is between 1982 and 2004. And most of us are between, the fifth and sixth decade of life, whereas they are in the second or third decade of their life. And they do use technology, but they assume technology as a part of their life. And we are convergent learners. That is how we were actually taught to learn. But these young boys and girls are assimilative learners. So we have to realize this fact that they are different medical learners. Similarly, the digital immigrants, we believe in traditional educational techniques, which is teacher-led, memory-focused. It is knowledge bestowed upon by an authoritative source. And the most important is that we actually were trained in written communication and information, and our training was outcome-based assessments. Whereas the digital natives, they have got evolving educational techniques. It is not teacher-led, it is student-centered, performance-focused. The learner constructed knowledge from multiple sources and experiences, and at the same time, they actually process from the digital information and the communication systems. And their training is basically competency-based assessments. So this is very important to understand. So how do we train competent and professional surgeons more efficiently and effectively? Now, I would tell you about the Cpsp training model, especially focusing on the surgical residency. Now, Cpsp, like other postgraduate institutions of the world, has moved to competency from the outcome-based model that integrates research, training, and clinical service. And Cpsp has developed its own model and its own innovations. Now, what is our competency model? Basically, the patient care is right in the center, then it's teamwork, communication skills, technical skills, knowledge and critical thinking, and research. And absolutely, we based our competency model on advocacy, pedagogy, and professionalism. Cpsp actually has a STAR program where we have got induction, curriculum, training, monitoring, and evaluation. So every Cpsp surgical trainee has to go through an induction process. They have to go through a proper curriculum, a training model. They're monitored through e-log, and ultimately they are actually evaluated as well. let's see what is the CPSP induction system. Now, this is the FCPS road map to surgery. You know, MBBS, 1 year house job, you have to pass the FCPS part 1, register with the registration cell of CPSP. Then you have got 2 years of basic training, an intermediate module examination. Then you go to year 3 and 4 for general surgical residents and another year for the specialty trainees as well. And you know, every year in January and July, we have got inductions. And in every training unit, we induct 4 residents of general surgery and 4 residents who would complete their 2 years in general surgery and 2 years later or 3 years later in specialty. So this is how, you know, if we start year 2021, they will progress into year 22 and 2023 and then 2024. And that is how, you know, in a surgical unit, in the year 1 and year 2, they will each have 16 trainees every year. And in the year 3, it will be reduced to 8 trainees, and in the year 4, because, you know, these trainees will be moving out into the specialties. So this is the number of trainees which one surgical unit have in a 4-year training program. Okay, so what are the training innovations of CPSP? In addition to the curricula, CPSP has designed color-coded, user-friendly, structured visual curriculum display charts hung at the most prominent place of the training site to provide ready references to trainees and trainers regarding, one thing is competencies to be achieved during, you know, with their levels, rotations with durations, and timelines for synopsis and dissertation submissions. So in one go, I would just show you what is a structured visual curriculum display chart, which is actually indigenous for CPSP, for its residents. Now, you're all familiar with this structured visual curriculum display chart. This is hung in each and every surgical ward of the country. And there are certain competencies, and then the level of the competencies are there, and each competency is defined. And then actually, these residents and the supervisors are supposed to follow this competency chart models. And you have got every information that what kind of rotations are required, what will be the training duration, what is going to be what are going to be the workshops, and what are going to be the competency levels. So everything is there in these SVCD charts. And CPSP has got a support system in all the 14 regional centers all over Pakistan. And these regional centers are, not only in Pakistan, but we have got 2 centers in Dublin, and we have got a center in Dublin and in Birmingham in Europe, and we have got 2 centers, one in Jeddah and Riyadh in Saudi Arabia, and we have got a center in Kathmandu as well, because we do understand that it is an international training program. And we have got an outreach to all our centers through this video conferencing facility, and this video conferencing system is owned by CPSP, and this is through a secure fiber optic line which is owned by the College of Physicians and Surgeons of Pakistan. And we do understand that we would actually always like to have a quality assurance of our training programs. And in the training, how do we achieve a quality assurance? Number one is that there is a very significant accreditation criteria for a training unit. That is, we do not recognize every surgical unit. It has to be accredited. There's an accreditation criteria for the supervisors as well. And there are certain overarching competencies which have to be achieved. There's a single curriculum which is for every surgical resident all over Pakistan. We have our own competency charts, and there's a uniformity in induction. That is, inductions are done not mid-year or in every month, but they're just done in January and July. And there are proper workshops for trainees and supervisors. Similarly, in the examinations, we assure a quality. We have the blueprinting systems of examinations. We have got item banking, uniform examinations all over Pakistan. We have got multiple assessment tools. We have developed guidelines for the examiners. We have developed rubrics for scoring. We have got panel of examiners which are from which we select that which panel of examiners is going to go to which city. We do induct foreign examiners, and we always do a post hoc analysis as well. Now, one of the biggest features which CPSP has developed is a system of online examinations. And we all know that initially we used to conduct around 240 paper and pencil examinations in a year, simultaneously in different cities of the country. So that was very difficult to conduct because sometimes there was such law and order situations that we had great difficulty in getting our examinations conducted. So to overcome this, now we have got these examinations. They are being replaced by computer-based exams, which will be held even more frequently to limit the number in each exam sessions. And we are already doing that. And that we have achieved only because of the reason that CPSP has got a 3-layered VPN online system examination. We have got our own secure fiber optic line so that no examination systems can be hacked and there could be no interventions and interruptions. Now, this is a very important component, that is the monitoring. The IT department of CPSP has developed an innovative web-based CPSP e-logbook for monitoring of its extensive network of training, which allows timely entry of work done by each trainee. Supervisors need to verify and they need to ask to discuss the entries. Submission of quarterly feedbacks of each trainee by the supervisors. Quarterly generation of a progress report on both trainees and the supervisors. So we do keep a very close eye on how actually things are being done. So you are all familiar with the CPSP e-log system because you all really get an access into the CPSP e-log system. And you know that you have got e-portals where you can actually go and do your entries and access all the kind of different facilities which CPSP offers. This is just a dashboard of the e-logbook. This is all developed by CPSP for our own residents. And then finally, the biggest question, that is, how can we reorganize surgical education to train residents and which are able to achieve better surgical outcomes? Now for this, actually, we thought that training competent and professional surgeons efficiently and effectively requires innovations and modernization of educational methods, with the recognition that surgical classroom is under constant transformation and an understanding of today's learners and learning styles. With the growth of technology and the restriction of work hours in surgical education, there has been an increase in the use of simulation, including virtual reality, robotics, telemedicine, and gaming. The use of simulation has shifted the learning of basic surgical skills to the lab, reserving limited time in the operating room for the acquisition of complex surgical skills. So if we have got bench training and if we have got simulated learning, especially in laparoscopic surgery and on the bench training, then we can actually spend most of the time in the operating room for acquisition of complex surgical skills, which we cannot teach in simulations. So it's very important to understand that they are an integral component of our surgical training now. Now, CPSP is quite progressive, but to develop these workshops and to develop all these things so that learning could be possible, we had to take the help of the American College of Surgeons, the WHO, the American Heart Association, and the American Medical Association for Obstetrics and Gynecologists as well, so to develop these courses. So we actually had a close collaboration with all these departments. Now, in order to strengthen trainees' professional skills and training programs, CPSP holds capacity building short courses, workshops in which their participation is mandatory and a prerequisite for appearing in an examination. Now, the courses which are conducted by the medical education department, which are necessary for every trainee, are basically the research methodology, biostatistics and dissertation writing, communication skills, and introduction to computer and internet. And these workshops have been designed and developed indigenously by the college for its surgical trainees and surgical residents as well. And then we offer courses by the Advanced Skills Department. And on top of the line is the Advanced Trauma Life Support, which is for the surgical residents. So if they really want to learn how to do, emergency surgery and how to actually provide support to people who are coming into the emergency, they need to learn this. And then we have got advanced cardiac life support and the basic life support and advanced life support in obstetrics and gynecology. And we also teach the basic surgical skills. So for the surgical residents, basic surgical skills and advanced trauma life support and a basic life support would be an essential part of the training. And Cpsp also developed this advanced skills department. The advanced skills department is serving as a main core in the advanced skills for trainees and fellows of Cpsp. Advanced skill department daily receives about 100 plus registrations from ASD courses around Pakistan. Last year, besides the corona pandemic situation, we have encouraged to arrange, following activities in 2020. And you can very well see that what kind of, activities which we provide. We perform all the basic life support courses, which can be done anywhere in the world as well. And if you can see this, since 2007, we have actually started all these courses, and you can see the huge number of courses which we have done, and the number of participants which we have actually trained in the basic life support, the ACLS, the PALS, ATLS, and the also provide. And you can very well see that we have held about 198 courses of ATLS, and we have trained 3,037 surgical residents in this aspect, and we have actually imparted of basic life support in about 28,156 trainees all over in Pakistan. This is a huge number done by any training institution anywhere in the world. And not only we run the basic courses, but initially we would always call instructors from abroad to train our residents, but now we have developed our own instructor courses, and now we actually have our own instructor pool, so that we do not have to look abroad every time to get our residents properly trained. And recently the College of Physicians and Surgeons of Pakistan has actually acquired the course of the fundamentals of laparoscopic surgery from SAGES. And the Cpsp has started conducting fundamentals of laparoscopic surgery courses affiliated to SAGES since 2019. There are 2 active proctors conducting this course all over in Pakistan. And Cpsp is going to train 2 more proctors as the demand of FLS is increasing by the passage of time. So if you can see the data of FLS since 2019, we started this in December 2019, so it's almost 1 year and 1 month. So the total number of registered candidates is 30, 18 have appeared, and 12 are on the waiting list. But there is a huge number of people who are waiting for the fundamentals of laparoscopic surgery. And I must remind my audience that all these courses, whether it is the fundamentals of laparoscopic surgery, fundamentals of endoscopic surgery, the advanced trauma life support, the basic life support, the advanced life support for obstetrics and gynecology, the advanced cardiac life support, and pediatric advanced life support, these are the franchises from the American College of Surgeons, the American Heart Association, the American College for Medicine, and it is from the SAGES. So these are accredited courses, and whoever does this course here in Pakistan, and it has been signed by the Cpsp authorities, this course is recognized everywhere in the world. So to take you forward, now we have just on the verge of getting the fundamentals of endoscopic surgery. And I'm sure that, it was supposed to be started in the year 2020, but because the COVID situation, we were not able to, materialize this. But in the year 2021, in the first week of March, we will be able to launch the fundamentals of endoscopic surgery. And now this would be, to train our residents, it is very important to understand that these digital natives, they learn in a different way. So their training is not to be focused more on theoretical basis. Their training has to be focused mostly on practical basis. And if we have to actually take account of these digital natives, they learn much better digitally. So it is very important that they should, be drawn towards actually such programs where digital technologies used, such as fundamentals of laparoscopic surgery, such as fundamentals of endoscopic surgery, such as advanced trauma life support, such as advanced cardiac life support, and workshops on internet, and workshops on digital writing and statistical writing and research methodology. So that is how we would be able to, produce a crop of surgical residents who would be much better trained digitally. They would acquire bench trainings, they would acquire trainings from simulation training, and their time would be utilized most in the practical aspects rather than theoretical aspects, like working in the emergency, getting hands-on training, and then going on to the main surgical operating room so that they are able to get hands-on training in more complex surgical procedures rather than just learning the basic surgical skills in the operation theater. And so that is what we're looking forward. And Cpsp is further looking forward to develop its own new regional center at Kalashakaku. Recently, we have acquired 26 acres of land where we are going to build up a new regional office for the College of Physician Surgeons of Pakistan. And the crowning component of this regional center would be that Cpsp is going to have its own hospital, because we really want to show the government in Pakistan that how should be a modern hospital working like, what are the essential components of a teaching hospital, and how the surgical and the medical residents could be trained. And if you can see that apart from the, the offices and the hospital and everything, two very integral components of this, campus is that there's a huge laboratory for skills, which is known as the skills lab. And then there is a huge laboratory for developing new methodologies, new equipment, new instruments. And we are taking collaborations from other universities of the world and our own Pakistani universities to develop new technologies as far as the instruments are concerned, as far as the techniques are concerned. So we are going to have two very important components over here. Number one, a skills lab, and number two, a lab which is going to develop new technologies, develop new, new operative technologies, new instruments, and new innovations. So that is what we're going to look forward. And that is how we plan that further, training of the surgical residents would be evolved all over in Pakistan. Thank you very much for your patient listening. And I hope that I've been able to put my message across. Thank you very much.